Korean Americans have the highest prevalence and incidence of diabetes mellitus in the United States among all Asian subgroups, with a rate of 17.2% of cases per 1,000 person years.
So I think we need more help and we need more information from any other source, like Korean communication or any facility can help will be better. If I go with my dad to the hospital, we can't find any translator neither, so we don't have that much information about the diabetes. So if there's anything more than if we can get more information about the diabetes, it will be.
The Korean Americans have the highest rate of an insured status among Asians at 31%. They are also 4 times more likely to not have had recent contact with a healthcare provider. A diabetes-related nurse telephone counseling program with bilingual staff and translation services is proposed to target the Korean American population. Korean American community health projects have demonstrated significant progress in self-efficiency and clinical outcomes for patients with diabetes mellitus. Possible challenges to this proposal may include difficulty in the recruitment of patients, the appropriate selection of qualified bilingual nurses who are familiar with the Korean American culture and community health. The integration of accountable care organizations, or ACOs, through the Affordable Care Act, or Obamacare, will benefit the proposal through coordination in care, risk factors management, and implementation of strategies that address issues beyond clinical attention for chronic illnesses such as diabetes mellitus. It also has the potential to provide the Korean Americans access to quality care by provision of universal coverage to everyone.
Korean Americans have a tendency to conceal their illnesses even to their families and avoid outside assistance due to a desire of maintaining an outward image of health. The telephone counseling services keep minimal physical contact with the patient to address the needs for culturally competent interventions and the group's preference for privacy. In an article by Bodie, Hong, M. and Chong in 2011, it was concluded that Korean churches and community associations serve as valuable partners and may be sued to serve as channels of support.
Subsequent to month 1 of counseling, the nutritional and lifestyle factors that are significantly related to diabetes among the Korean American participants will be clearly identified. Within month 6 into the program, the projected decrease in hemoglobin A1C to a minimum of 1% less from the original reading, or as close to the normal level of 5.9%, will be achieved from at least 80% of the participants. Consequently, the adherence and continued compliance of participants to dietary and lifestyle modifications are anticipated to pursue.
At least 3 registered nurses specialized in diabetes mellitus management will be hired to facilitate the telephone counseling. The staff must be proficient in the Korean language, competent on Korean American culture, and must possess good counseling and therapeutic communication skills. For the participants, 75 people will be recruited based on the inclusion criteria such as Korean American origin, a diagnosis of diabetes mellitus type 2 for at least a year, aged over 20 years, and residence in Los Angeles County. Telephone counseling sessions will be done weekly and as needed for nutritional, lifestyle, and blood glucose monitoring. A possible barrier is the lack of appropriate telephone service and socioeconomic concerns. For the evaluation of outcomes, the staff will track and document the participants' progress weekly with a reassessment of risk factors and hemoglobin A1C after 6 months. The counseling topics will be limited to those that are within the nursing scope of practice.
The decrease in hemoglobin A1C is directly associated with reduced risk for chronic and worse complications in Korean Americans with diabetes mellitus. Individualized treatment goals with proper integration of ethnic background and needs assessment ensures the most appropriate and culturally sensitive care.
Telephone counseling can be a cost-effective solution to disseminate information and a proven means for behavioral counseling to improve lifestyle habits of diabetic patients.
The continuing innovations in society influence the degree of acculturations in various aspects such as health services, accessibility, physical activities, and healthy eating habits.
An interdisciplinary approach is highly valuable to achieve success in the goals of care of a patient.
Particularly, this proposal highlights the nurse's role as an integral member of a healthcare team.
Acculturation considerably affects the Korean Americans' management of diabetes mellitus. Moreover, studies reveal that similarities in cultural orientation and life experiences in Korean American patients and healthcare providers greatly facilitate cooperation and compliance to treatment regimens.